Those of you with whom I've had the privilege, pleasure, and honor to serve in medical jurisprudence, medical ethics, and in neurobehavioral sciences, this may bring a memory back, and I hope it is not post-traumatic stress disorder. I hope instead it is a pleasant memory. We talk about mind, body, and spirit. 3 lengths of rope, each representing that tripartite concept. A small length of rope, a medium length of rope, and a long length of rope. Now, if I may, I'm going to hand the short length of rope. May I hand that to you and ask you, please, to take the end, tie down one. You'll notice that rope is in the career is going nowhere. It does not stretch. And if I may I hand you the middle length of rope and ask you to do the same, and you'll notice that does not stretch either. And if I may, I'll hand one end to each of you, and without turning over a cup, I'll ask you to tug gently. You'll notice it does not stretch. And I'm going to go back the short length of rope, the middle length of rope, and the long length of rope. And I thank you all for your kind assistance. I want you all to be able to see. What I may do is I may retire momentarily to the center there so everyone can see. Is that appropriate? Is that okay? I will do that. Thank you. 3 lengths of rope. The short length, the medium length, the long length of rope. We take the 3 lengths of rope. Starting together at the top, you notice they all vary in length, because thank goodness all present are visually intact. The acuity to see if they end at points B, C, and D. We place the ropes into the hands, so now the ropes cannot escape. I take the ends of the ropes and I keep them up, so that now the ropes begin and end at approximately the same place. Now, if I would ask you, are these ropes equal in length, because they all start and stop at approximately the same place, you would say, Dave, of course they are not, because their middles are different, which reminds us, in fact, when we are treating patients, we want to be aware of their middles, because we don't want our treatment to put weight on them, because if they weren't depressed before, if 30 or 40 pounds of weight, they will be depressed now. This represents the mind, body, and spirit of ourselves. We want them to be in equal balance as we move through medical school, rotation, internship, residency. We need to be mindful as physicians to take care of ourselves. We need to be mindful that we need that balance. So hopefully, the magic of medicine, the benefit of science, just as these 3 curves are now equal in length, so too, hopefully, as you traverse your medical education, you will be able to maintain the balance in your life as well. I brought 3 magazines with me today. These 3 magazines came from the waiting room table at the office, and they're of different topics. I thought I would ask if I might, as I move to my topic, can I ask you please to point to any 2 magazines? Okay, very good. I hand you that, and I will ask you. Okay, very good. And now, I'm going to ask if I might, if you will, please, I'm just going to, if you may stay seated, it's okay. I'm just going to have you say stop at any time. Very good. You stop in here, page 59. So I ask you, please, if you'll turn to page 59 in your magazine. I just want to see it. Magazine you randomly selected, another magazine randomly selected, and a page number randomly selected. And once you turn to page 59, I ask you, please, looking at a random page. And as you focus on it, concentrate on it, you notice, interestingly enough, the page that you looked at has colors, prints. I see leaves falling, as it were, almost artistically. And I see in bold print at the top how apropos for today's discussion it says, be well. Is that correct? Please open up the magazine and show that to those around us. And it reminds us, our goal is to help others to be well. We want to stay healthy ourselves. Thank you. I'll borrow back the magazine and thank you. If I may, I have a calendar and a deck of cards. And I don't want to embarrass anyone at all. Is there anyone here amongst us today who has a comfort level with playing cards to the extent of shuffling cards? Is there anyone who's comfortable with that? You won't be embarrassed by doing that. Very good. I appreciate that. It does not in any way, shape, or form bespeak a misspent youth around gaming houses.
Don't worry about that.
Very good. I'm removing the jokers from the deck, and I will hand you the deck of cards. I'm just going to ask you, please, comfortably, just to kind of shuffle up the cards, mix them. I don't want you to think they're in any specific order. They're not. I have a calendar here, and I'm going to ask, if I may, I'm going to hand the calendar. I just want you to hold on to the calendar. I'm going to ask you, please, I'd like you to tell me how many days are there in a year?
That would be embarrassing if I got it wrong, but I think it's 365.
Perfect. Excellent. And from January 1st to December 31st, is that right? And I'd like you, please, to silently right now think of any date you want here, like April 10th, April 14th, September 1st, any date you want. And once you have your date, I'm going to ask you, please, to share out loud with us the date you're thinking of.
May 12th.
May 12th. Very good. May 12th. And now, as you're shuffling the deck, in a moment, you'll notice, am I right, there is a rubber band around your calendar. Is that correct? That's very good. I'm going to ask, if you will, to remove the rubber band from the calendar, if you will. Rubber band from you. And have you hold on to this. In a moment, I'm going to ask you actually to turn to May 12th in your calendar. I'll borrow back the deck of cards. You feel, you're going to come over to here. You feel these cards are thoroughly totally mixed. Am I right? I'm going to ask you, please, just take it off at any. Very good. I'm going to ask you to remove the card which you told me at random. You could have had any card you wanted. That was the card you selected. Is that right? I'm going to ask you, if you'll please, you turn to the calendar. You'll notice in the calendar, on every day of that calendar, from January 1st to December 31st, there is a card, playing card, handed next to every day in the book. Am I right? Randomly placed there. So had you selected, instead of May 12th, May 11th, what card would you have selected at May 11th?
3 of Hearts.
3 of Hearts. You didn't select that, did you? No. Had you selected May 13th, what card would you have selected?
10 of Spades.
10 of Spades. But we didn't select that, did we? No. Now, you selected a card at random from a thoroughly shuffled deck of cards. Is that correct? And you have a card at random. What we're looking at here today is synchrony. We, as clinicians, physicians, and DOs, we work together. We have a philosophy that binds us together in thinking, in practice. And when you're out in practice, you won't work alone. You'll work with colleagues. And when in doubt, you'll call a colleague and you'll ask for their thought. And in fact, here today, hopefully we illustrate the synchrony that exists between us and among us, as classmates, as colleagues. Because you have a date, and I'm going to ask, would you please tell us what card is there at your date?
King of Hearts.
The King of Hearts. Would you please hold up the card you selected? It's a pleasure to have been asked to present today and to join you all. Please enjoy your day, and please enjoy your weekend, and the rest of your education be a joy and a treat, and may you bring so much healing to your patients throughout your life. Thank you all again.